Hello, hello, hello. Today we are continuing the discussion on cardiovascular diseases. Told you that is that big old word that talks about what is affecting our heart and our blood vessels and things like that. And the reason why we're still talking about it is because it is the leading cause of death. We talk about things like cancer and all of that. It's bigger than that. It is the leading cause of death. And the number one cause under that umbrella of cardiovascular diseases is heart disease. The other one that comes behind it is stroke. And the one thing that make these two like come together, or that these two have in common rather, is high blood pressure. So that is what we're going to talk about today. Because if high blood pressure is causing all of these issues and it's affecting all of these things, we really need to sit down and have a discussion about it. But we're going to simplify it. I'm not going to overcomplicate it, but help you to understand it and what it is, because there are so many different misconceptions about it. There's so many myths and everything that's out there. So we're just going to set the record straight. Today, we're going to talk about it, and we're going to easily understand high blood pressure and what you can do about it. If this is your first time watching, thank you so much. And if you are continuing to watch, I really appreciate it. I am Dr. Booth, and welcome. I am a board certified family medicine physician, and I'm also the owner of Healing Beyond the Stethoscope Primary Care, where we provide personalized, comprehensive care. And I also provide practical health tips that you can use in your everyday life. Now, go ahead and do those simple things for me, which is subscribe and like, follow, share, all of that stuff, because it helps to get that information out there. Because I know that these are some of the things that people absolutely really need to know and can use, right? So let's talk about this thing. What have you heard about high blood pressure? Because as a family medicine doctor, I have heard all the things. So you are not going to surprise me. You probably heard that you will have a headache, and that is going to be the indication that you have high blood pressure, right? You probably heard, oh, that's for old people, people who are in their 50s. I mean, 50 is not that old, but depending on where you are in life, 50 could be seen as old, whatever. You're like, that's for old people, 50, 60, 70s. That's who have high blood pressure. That you may have to take medication, right? So, oh, you got to do that. Well, let's talk about it, because the truth is, it is a silent killer, and it is killing a lot of people. And I'm not making this up. It absolutely contributes to a lot of people, and it's a silent killer because you don't have any symptoms. So let's just put that myth out of the window that, oh, when I have high blood pressure, it's going to tell me something. You may, but a lot of times, and the majority of people have no symptoms. The other thing is that people say, well, when I get in that danger zone, or that 200s over 100s, that's when I'm really at risk and when I'll have a stroke. We're going to talk about that a little later. So I want to make sure that you stay until the end, because I'm going to tell you like the parameters and when we really need to start paying attention to it. So what the heck is high blood pressure in the first place, right? Like, what is it? So it is pressure in your blood vessel, and it is kind of stretching it, and it is putting pressure. So you have your blood vessel like a little tube. The blood is going to flow through it. And as that blood flows through it, then it can have a high pressure where it's stretching it and it's causing some tension on it, or it can have a low pressure. So when you have that high pressure, what it does is it starts to create that tension on it. When it creates that tension, the vessel says, okay, you pushed me a little too far. You've given me some pressure, right? You've gone a little too far, and now I have to do something to protect myself. So then it starts to kind of remodel itself. When it does that, sometimes it makes that blood vessel more stiff, which we don't want. And then that also just leads to some overall damage, because if you think about it, blood goes to every single inch of your body. It goes all the way around. So if that pressure is high, it is causing some damage to blood vessels all over your body. That is leading to damage all over your body. And some of the areas is heart. So that's where we end up with the heart attacks. The brain, you have strokes. You can have different types of strokes. One is like the aneurysm. That's one of the ones where we know that the blood vessels had too much. So you can have that. And then your kidneys. And these are all parts of the body that I don't play with, right? Because these are all serious parts that we need. But when it gets to the kidneys, that's when we're looking at dialysis. So, what do we need to do, and what is your goal? And let's start thinking about it. So, Your goal of your blood pressure, most of the guidelines are saying the less than 120 over 80. So you have your top number, which is your systolic, you have your bottom number, your diastolic. If you have 120, less than 120 at that top number, you're good. You have less than 80 on that bottom number, you're fine. Then as you start to increase and go up, then it says, okay, we got to start doing some things, putting some things in place. Once you hit 140, greater than 140 on the top, that says that's too much. And if you have greater than 90 on the bottom, that's too much. In the middle between that 120 and that 140, we have some room to start putting things in place. They say there's different stages and all that kind of stuff. Let's just think about our 120 and our 140. That's where you want to be less than that 120, and you definitely don't want to be over that 140. When you're in that middle zone, that is when you can start thinking about lifestyle stuff, because people are like, I don't want to take medicine. I don't want to be on medicine. I hear you. I understand you. Well, then we have to start doing some things to get it under control. And that's when they talk about lifestyle changes, where it truly is a lifestyle. It's not like a diet that I'm going to do today and then I do it for a few months and then, oh, that didn't work out. Whatever. We're really going to start putting those lifestyle things in place. Once you hit that 140 over 90, that's when we really say you are in the danger zone and we need to start medication. A lot of people start talking about that 200s over 100s, and that has made the news. But I've seen people in that 140s, 150s, over 90s to 100s either come into my office with a rolling walker. I have gotten reports from the hospital, all of that because it says they've had a heart attack or a stroke. So that 140 over 90 really is your danger zone. That is when you need to be on medication. We could talk about putting the lifestyle things there in place too, but you also need to be on medication, because if not, if you live there for too long, then you're going to have an issue. And the thing is, you may not even know how long you've been living at that range. So that is one of the things that you want to start thinking about. If your blood pressure is 140 over 90, you are at risk of high blood pressure, of a heart attack and a stroke. And we have to start putting things in place. This is what I say about medicine. Medicine is to protect you. Because I know one thing that you don't want a heart attack, you don't want a stroke. Because if you could take one medicine that can keep your blood pressure down for this period of time until you can get it under control with maybe some lifestyle stuff, then that's what you want to do. Because if you have a heart attack or a stroke, you're going to end up with a bag full of medicines. And I'm very serious. I'm not like making this up, because once you do that, it automatically buys you about five medicines. You're going to have blood pressure medicine, you're going to have a cholesterol medicine, you're going to have a medicine to thin your blood, you're going to have another medicine that's going to probably help with your platelets. Then you're also going to have some specialists. You're going to have your cardiologist, and you can have a neurologist, and maybe even a vascular surgeon. So you went from one doctor and one medicine to like three doctors and like five medicines. You don't want that. So to prevent all of that, take the one medicine or whatever it is that you have to do, put the lifestyle things in place so that you can be okay. Now, the thing that causes blood pressure, because people's like, how did I get this in the first place? Like, what are my risk factors? Well, some of the things is, one is obesity or being overweight. We know for a fact that, especially as the midsection increases, because I had someone say, well, I'm just big boned. I'll give you that. Okay. But if your midsection is large, that's not big bone. Okay. It's not. So if that part is larger, then that is telling me that your risk of heart attack, stroke, blood pressure, all of that goes up. So the more you can get that off, then that's good. The other thing is smoking. Smoking significantly increases it, and is one of the easiest things that you can do if you stop smoking to decrease it, because we know, like, within 30 minutes of smoking a cigarette, your blood pressure goes up. We've seen it. So we have to wait and see what happens after that. But it that quickly can make your pressure go up. So that stress, a lot of people don't want to talk about stress. I'm going to do a show on stress, because the number one reason that people make a doctor's appointment is stress, and they don't even know it. It's like, how is that? Like, make it make sense. I know, but stress is one of those that's in there. If you can get that down, that'll definitely help. Your family history for sure. If your mother, your father, your sister, your grandparent, like all of these people have it, that could be a factor. But we also have to start looking at diet, because a lot of times what your family eats, then you also eat. So then you can also become a product of that. So it might not totally be genetic. It could also be some of those lifestyle things. So you have to think about that. And then just being more active. So if you are inactive, you don't really exercise, you don't do the things you like, kind of going here and there all day, but you haven't taken a chance to just get out and walk or any of that kind of stuff. Those are the things that are going to increase your risk of high blood pressure, increases your risk of heart attack and stroke. But I just don't leave you here and I'm not like, okay, oh, woe is me. No, we have things that we can do. We have things that we are going to do, right? So the number one thing that you can do is move. Move. Like everybody puts like a time number and all that kind of stuff on it. The recommended is 30 minutes a day, 5 days a week. One, two, three, four, five. 5 days a week, 30 minutes a day. Some people say, I don't have 30 minutes. Okay, if you can do that 30, if you don't have a chunk of 30, if you have 10, you can do 10 3 times a day. That's great. People say, well, what about the steps and the 10,000 steps? That's awesome. They did a study that said 7,000 might help you, then even down to 4,000. But at the end of the day, it is moving, getting out, moving, and consistently moving. I have some people say, well, I go to work and I move at work. If you're consistently moving for 10 minutes, then great. But if you're moving, oh, here, there, okay, I'll stop in that distance and then here, and then I stop. That's not enough to kind of get things going. So get moving, whatever you can. The other thing is controlling those risk factors that I talked about, that high blood pressure, diabetes, smoking, any of those risk factors, things that you can control, and you can get them under control. Those are the things that you really want to start focusing on and see, what can I do to kind of help myself be in the best position that I can be in. And then the other thing and the last thing is establishing care with your primary doctor. You knew I was going to say it. If you're like, oh, okay, no. But listen, it is so true, because, like I said, it is a silent killer, meaning that it's quiet. It's not saying anything. You may not have any symptoms. I have a ton of people who come in here, their blood pressure is up that day. I don't necessarily, depending on how high it is, I won't say you have high blood pressure. What I say is your pressure is a little elevated today. What I need you to do is start checking it at home. If we're still getting these same readings at home, then we need to start talking about it. We need to have a different conversation. So you want to make sure that you have that checkup with your doctor so that you will know what's happening with your body. I have people who have high blood pressure, they have pre-diabetes. These things are happening and you have no idea, because, like I said, they are silent. But you go, you do your one-time checkup, your physical, you come in, you see your doctor. They're going to do your vital signs, which includes your blood pressure. They're going to do your labs. They should listen to you and take the stethoscope and listen on your body and see and make sure everything sounds okay. And then they'll go through a list of, okay, these are the things that you may be at risk for. These are the things that we need to make sure we keep on our radar. And this is the game plan going forward, so that that you are okay, or you're not like, oh, I think I'm fine. No, I know that I'm okay, right? Like, how good does that feel to say, no, I know that I'm fine? Like, I went to my doctor last year and they said everything is fine. They said, see you in a year, right? So you want to have that. And not only do you want to have those labs and stuff done, really, truly, and hear me on this part, have someone to go over them with you. You don't want to just get a message that says everything was done, everything was normal. What's everything? What did they check? Did they look at your thyroid? Did they look at your B12? Did they look at this? A lot of times they're not checking the things that you think they might be checking. There's like a basic list of labs that they're doing, and then there could be some add-on things depending on what's going on. So you want to make sure that you know what's normal. Are your kidneys normal? Are your blood counts normal? Like, what is normal? So have someone to discuss that with you. If you have not had an appointment with your primary care doctor, now is the time to do it. Don't wait, because a lot of times they're like, oh, I have tomorrow, oh, I'll do it later. No, and then later you look up, you're sitting here and this is this time next year, and you're like, oh dang, I still haven't made that appointment. Go ahead, get it scheduled, partner with somebody who is going to really look out for you and go over those things and explain it to you so that you will know. If you're in the Savannahs and surrounding area, especially Georgia, South Carolina, we are licensed for that. We do physicals. You don't really have any concerns, and you're like, oh, I just want to check this out, because I know we have people who do our membership, but we have non-membership people, and people who say, you know what, I just need a physical, and I want to make sure I'm up to date on everything, and I don't have any questions or concerns. I just want to make sure everything is fine. We have you. We got you. So you can come and check us out, and you just use our little link right here to go to it and sign up. If you are, and the way our physical works is we go through all of those things and we don't leave you hanging. So you have your physical, you come in, we do the checkup, but then we also follow up with your labs, and we do a complimentary follow up, and we say, this is what was normal. This is what was happening. This is something we need to keep on our radar and we need to look for. So that way you'll have a game plan. And also, we are giving away a free physical because we are celebrating 2 years in practice. And that is our gift to you, because we want to make sure that you are well. So if you are in need of said physical, then make sure you look us up. We are celebrating on tomorrow. Come by our office. You get signed up to enter to win. You can also send us a message and say, hey, I'm interested. We can let you know how it works from that standpoint. But we really want for you to be well. So we are going to give away a free physical to someone, so that way they can know, hey, I am well and I feel good about knowing like where I am and what are the next steps that I need to put in place. Because I'm telling you, strokes, high blood pressure, all of this kind of stuff is no joke, and it is not something that you want. You want to make sure that you don't have to have these things if you don't have to. But at the end of the day, I wish you well. I am wishing you much, much healing. And until the next time, I will see you soon. Take care.